What if I told you that the cholesterol levels your doctor calls normal after age 70 might actually be putting your brain, immune system, and overall vitality at serious risk? I know that sounds shocking, especially when you've been told for decades that lower cholesterol is always better. But here's what might surprise you. Emerging research from leading medical institutions is revealing that the cholesterol guidelines we followed for 40 years may not apply to adults over 70. Picture this familiar scenario. You're 72, you go for your annual checkup, and your doctor celebrates because your total cholesterol is a 180 and your LDL is 95. Perfect numbers, they say. But 3 months later, you're struggling with memory issues, frequent infections, or unexplained fatigue. Could there be a connection? Recent studies published in the Journal of the American Geriatric Society and research from Harvard Medical School are challenging everything we thought we knew about cholesterol in older adults. The data suggests that what we call optimal cholesterol levels in seniors might actually be associated with increased mortality, cognitive decline, and immune dysfunction. The consequences of maintaining artificially low cholesterol after 70 could include accelerated brain aging, increased infection risk, and paradoxically higher cardiovascular mortality in certain populations. This might sound controversial, and I understand if you're skeptical, but please give me a chance to share the science that's changing how forward-thinking physicians approach cholesterol management in older adults. In my practice, I've treated thousands of older adults, and I've witnessed firsthand how rigid adherence to younger adult cholesterol targets can sometimes harm rather than help my patients over 70. I've seen 75-year-olds with perfect cholesterol numbers struggle with cognitive decline, while others with moderately elevated levels maintain sharp minds and robust health. Today, I'm going to share 3 critical points that could change how you think about cholesterol management after 70. First, why the brain requires adequate cholesterol to function properly, especially as we age. Second, the surprising relationship between low cholesterol and immune function in seniors. And third, the emerging evidence about cholesterol and longevity that's turning conventional wisdom upside down. Before we dive into this potentially life-changing information, please hit that subscribe button and ring the notification bell. This channel is dedicated to bringing you evidence-based health information that challenges medical orthodoxy when the science supports it. Comment evidence below if you want more content that examines the latest research on healthy aging, and join the thousands of viewers who are taking an active, informed role in their healthcare decisions. Let me tell you about Margaret, a 74-year-old retired teacher. She came to me after her previous doctor had aggressively lowered her cholesterol from 220 to 160 using high-dose statins. While her lipid panel looked perfect on paper, Margaret was experiencing significant cognitive fog, muscle weakness, and had suffered 3 respiratory infections in 6 months. When we carefully reduced her statin dose and allowed her cholesterol to rise to 190, something remarkable happened. Within 3 months, her mental clarity improved dramatically, her muscle strength returned, and she went 8 months without a single infection. Her MMSE, cognitive assessment score, improved from 26 to 29 out of 30. Then there's Robert, age 78, whose family was concerned about his cholesterol of 240. Despite pressure from his previous physician to start statins, we monitored him carefully. 2 years later, his cognitive function remains excellent. He's never had a heart attack or stroke, and at 80, he's still hiking and managing his own finances. The research challenging aggressive cholesterol lowering in seniors is compelling. A 2019 meta-analysis of over 68,000 participants found that adults over 75 with total cholesterol between 200 to 239 had the lowest all-cause mortality rates. Those with cholesterol below 160 actually had higher death rates from non-cardiovascular causes. The Honolulu Heart Program, following men for 20 years, found that those whose cholesterol dropped below 200 after age 70 had significantly higher rates of dementia and Parkinson's disease. Similarly, the French three-city study of 9,000 adults over 65 found that low cholesterol was associated with increased depression and cognitive decline. After age 70, our physiology changes dramatically. The liver's cholesterol production naturally increases, possibly as a protective mechanism. The blood-brain barrier becomes more selective, requiring adequate cholesterol for neurotransmitter synthesis and membrane repair. Genetic factors become more important with age. People with certain APOE variants may need higher cholesterol levels for optimal brain function. Additionally, older adults metabolize cholesterol medications differently, often experiencing side effects at doses well tolerated by younger patients. Comorbidity considerations are crucial. A 75-year-old with diabetes may benefit from moderate cholesterol reduction, while someone with early cognitive decline might suffer harm from aggressive lowering. The biggest misconception is treating cholesterol the same way at 75 as we do at 45. Think of cholesterol like insulation in your house. When you're young and your house body is new, you might not need much insulation. But as your house ages, adequate insulation becomes critical for protection and efficiency. The number needed to treat NNT for statin therapy in healthy adults over 75 is approximately 100-150, meaning 100-150 people need treatment for one person to benefit. Compare this to the NNT of 30-50 in younger adults with heart disease. Most people don't understand that a 20% relative risk reduction, commonly cited for statins, might represent only a 2% absolute risk reduction in older adults without existing heart disease. For a 75-year-old with a 5% 10-year cardiac risk, reducing it to 4% may not justify the potential cognitive and muscle side effects. Progressive medical centers are now embracing what's called precision geriatrics, recognizing that older adults aren't just bigger children with more medical problems. The European Society of Cardiology has begun acknowledging that cholesterol targets may need revision for adults over 75. The core principle driving this change is simple. Functional capacity and quality of life matter more than hitting arbitrary laboratory targets, especially when the evidence supporting those targets in older adults is limited. As Dr. Beatrice Golomb from UC San Diego states, we may have been so focused on preventing heart attacks in 80-year-olds that we've been causing strokes, cognitive decline, and premature death from other causes. A landmark study followed 200 nursing home residents over 3 years. Those with cholesterol levels between 180 and 220 had the best outcomes in terms of cognitive function, infection rates, and overall survival. Residents with cholesterol below 150 had 40% higher mortality rates and significantly more infections. The scientific rationale is clear. Cholesterol is essential for immune cell membrane integrity and the production of stress hormones that help fight infection. In older adults, these protective functions may outweigh cardiovascular risks. Studies of people living past 100 consistently show that many have cholesterol levels that would alarm conventional physicians. The New England Centenarian study found that many healthy 100-year-olds maintain total cholesterol between 200 and 250 without cardiovascular disease. Research from France followed 120 adults over 75 who stopped taking statins. Over 18 months, 65% showed improvement in energy levels, 45% had better cognitive function, and surprisingly, cardiovascular events didn't increase. The key finding, those who had been on statins for primary prevention, no existing heart disease, did best when stopping. Stop obsessing over total cholesterol numbers below 200 after age 70, especially if you've never had a heart attack or stroke. The evidence for benefit in this population is weak, while the evidence for harm is growing. Reduce reliance on statin medications for primary prevention after 75. If you're taking statins and have never had cardiovascular disease, discuss with your physician whether the benefits still outweigh the risks at your age. Ask specifically, what's my actual 10-year risk reduction? And what are the potential cognitive and muscle effects? Stop accepting muscle pain, fatigue, or cognitive fog as normal aging if you're on cholesterol medications. These could be medication side effects that are reversible. Start focusing on cholesterol particle size and inflammation markers rather than just total numbers. Ask your doctor to test for small, dense LDL particles and inflammatory markers like hsCRP and IL-6. Prioritize dietary cholesterol from nutrient-dense sources. Eggs, fatty fish, and grass-fed meats provide cholesterol along with essential nutrients your aging brain needs. Start tracking functional measures like memory, energy levels, muscle strength, and infection frequency. These matter more than lab values for quality of life. Begin conversations with your healthcare team about personalized cholesterol targets based on your overall health, cognitive function, and life expectancy, rather than age-inappropriate guidelines. What do all truly beneficial health practices for seniors have in common? They improve functional capacity, enhance quality of life, and consider the whole person rather than focusing on single biomarkers. Brain health. Adequate cholesterol supports neurotransmitter production, myelin repair, and cognitive function. Studies show that moderate cholesterol levels, 190-230, may be optimal for brain health in seniors. Immune function. Cholesterol is essential for immune cell membranes and stress hormone production. Seniors with very low cholesterol have higher infection rates and slower wound healing. Muscle health. Cholesterol supports muscle membrane integrity and hormone production, testosterone, estrogen, that prevent sarcopenia. Many seniors on statins experience accelerated muscle loss. Quality of life. Rather than extending life at any cost, we should focus on maintaining independence, cognitive clarity, and physical function. Sometimes this means accepting moderately elevated cholesterol levels. The 2019 European Heart Journal published findings that adults over 75 with total cholesterol between 200-239 had better outcomes than those below 160. The Framingham Offspring study found that cholesterol's predictive power for heart disease diminishes significantly after age 70. Most importantly, quality of life studies consistently show that seniors with moderate cholesterol levels maintain better cognitive function, energy levels, and independence compared to those with aggressively lowered levels. When discussing cholesterol with your doctor, ask these specific questions. What's my absolute risk reduction from lowering my cholesterol, not just the relative risk? How do the potential benefits compare to risks of cognitive side effects at my age? Can we monitor my functional status, not just my lab values? What does the research show for people my age specifically? Look for studies that specifically include adults over 70. Be suspicious of guidelines based primarily on middle-aged populations. Seek information from geriatricians and physicians who specialize in healthy aging. Consider your overall health, life expectancy, cognitive function, and personal values. A 72-year-old marathon runner might make different choices than someone with multiple chronic conditions. Track functional measures. How's your memory, energy level, muscle strength, frequency of infections? These indicators matter more than hitting arbitrary cholesterol targets. The core principle here is revolutionary yet simple. Evidence-based medicine means using the best available evidence for your specific age group, not blindly applying guidelines designed for younger adults. You have the right to ask questions, demand age-appropriate evidence, and make informed decisions about your health. Your doctor should be able to explain why a particular cholesterol target makes sense for someone your age, with your health status, and your personal values. Health isn't about achieving perfect lab values. It's about maintaining cognitive function, physical independence, and quality of life. Sometimes that means accepting cholesterol levels that would have worried us when we were 50, but may actually be protective at 75. This isn't about abandoning medical care or ignoring serious risk factors. It's about recognizing that good medicine is personalized medicine, especially as we age. Remember, you're not just an older version of a younger person. Your physiology, needs, and optimal targets may be completely different now. Embrace that difference and advocate for age-appropriate, evidence-based care. If this information has opened your eyes to a different way of thinking about cholesterol and aging, please like this video and subscribe to the channel. Share this with family members or friends who might be struggling with the side effects of aggressive cholesterol treatment. Your health, your choice, your life. You deserve medical care that's based on evidence relevant to your age and circumstances, not outdated guidelines that may do more harm than good. Here's to your health, vitality, and independence, with cholesterol levels that support your brain, immune system, and overall well-being at every stage of life.